Welcome to the First Aid Show Daily Minute Podcast, your daily dose of first aid, brought to you by Australia's first and only first aid conference and exhibition, the First Aid Show.
All right, this episode might make you squirm a little, but it's important, so let's talk about rectal bleeding. Seeing blood in or around your stool can be alarming, but the colour of the blood gives us a clue where it's coming from. So, bright red blood usually means the bleeding is low in the bowel, close to the anus. This could be something like a hemorrhoid, which is common and often caused by constipation or straining. Dark red blood or mixed blood with your stools might point to bleeding in the colon. One possible cause? Polyps, small growths inside the bowel. Now these are often harmless, but in some cases can develop into bowel cancer. Now these are diagnosed by a doctor, not a first aider. But the colour gives you an indication. Now here's one that really gets attention. Black, tar-like stools with a very strong odour. That's called melena. That may signal bleeding much higher in the digestive tract, such as from a stomach ulcer. Common causes of rectal bleeding include constipation or hard stools, hemorrhoids, less common, bowel infections or gastroenteritis, polyps or bowel cancer, inflammatory bowel disease like Crohn's or ulcerative colitis, STIs, or even trauma. Now, how would you respond as a first aider if somebody came up to you? Start with DRS ABCD and wear gloves, always. If the bleeding is visible and free-flowing, gently apply a combine or a pad to the bleeding site. Have the patient lie on their back with their knees bent. This can ease discomfort. If bleeding is persistent or unexplained, refer them to seek medical attention. Usually a GP is your first stop. And if you're in a public or open setting, please remember, protect their dignity. A blanket or a jacket can go a long way. Now, rectal bleeding is a symptom, not a diagnosis, so while it may be minor, it could also be something more sinister. So it definitely needs to be followed up with a doctor. Respect the privacy, don't panic, act with care, and refer on as quickly as possible.
Thanks for tuning in to the First Aid Show Daily Minute Podcast. Don't forget to like, subscribe, leave a review, and follow us on social media for more first aid tips and updates. Until tomorrow, stay ready, stay confident, because a prepared first aider saves lives.